Mental health crisis. 600,000 Oklahomans report having mental illness, but many more may be affected. And the state is tackling a major budget shortfall, and mental health services may be on the chopping block. Joining us live this morning to shed a little bit of light on what can be done, how we can provide care to those thousands of people, hundreds of thousands in Oklahoma, is Mike Brose of the Mental Health Association Oklahoma. Thank you so much for joining us today.
Oh, it's my pleasure.
This has really become a focus for a lot of Oklahomans where it may not have been otherwise due to this budget crisis. Oklahoma has the second highest rate of adult mental illness in the nation, but we rank 43rd when it comes to actually funding mental health services. Why is this?
Well, I think it's a history, a legacy of what I call downstream funding, where we've kind of focused more on incarceration of people with nonviolent offenses, untreated mental illness, and trying to move upstream and reinvest our allocation of our dollars. So we do need more money, but we also need to use the dollars we have more effectively and get better outcomes for that. And that's been hard for the state and the political leadership to really get their arms around, but we're still pushing in that, and we're very hopeful.
So there needs to be a greater focus specifically on mental health issues and not just as it correlates to criminal justice reform and other topics. Okay,
That's
so
right.
The state is cutting funding, as we know, for education, for other aspects of health care, for veterans care. What is the case for keeping mental health care funding in the spotlight, given that we're in this budget crisis?
Well, I mean, if my physical health care it's affected, I can't perform as well at work or at school. Turns out it's the same thing with mental health. If I'm dealing with a mental health issue, I can't perform in my workplace as well, at full effectiveness. I can't perform educationally. We cannot leave this matter alone. We have to address it and address it more effectively. When you're looking at so many people in Oklahoma who can't access services because of lack of funding, we've got to invest upstream.
I feel like I have to mention these statistics. The Oklahoma Department of Mental Health and Substance Abuse Services has cut $23 million in funding, and that's affected 73,000 people that have either fewer options when it comes to mental health resources or no options whatsoever. Do you expect further cuts down the pike, and how will you cope with those?
Well, I don't know exactly how we're going to cope with it. I mean, more people are going to be unable to access services, and we've got to, again, it's about investment upstream, and we're going to have to make those decisions. We very much fear further cuts, and I don't know what we're going to do, but we've got to continue to let our elected officials know this is not the way we want to go for all of Oklahoma.
Only 40% of adults here in Oklahoma who may be coping with some type of mental deficit or disability are actually seeking treatment or counseling at this point, and that really is an alarming figure. 60% that means 60% are going untreated.
That's right.
How can the state provide care for these people within the confines of the budget that we're dealing with?
Well, we can't. The community mental health centers that are being cut, other services that are being cut, Medicaid cuts. We're not going to be able to do that. And, I mean, I really admire the Department of Mental Health, Terry White and her leadership, the community mental health centers, the providers. Everybody's doing all that they can, but you do have to have funding to be able to support these services. So we're going to see more Oklahomans unable to be able to secure services if we don't invest in that in mental health.
And you have been quoted yourself as saying that there needs to be a political will to rise up and say enough is enough. What do you believe it will take to generate that political will, the will among the lawmakers? And then once you have it, what should be done? What exactly do you want to be put in place?
Well, I'm glad you cited my quote. I have said that, and I continue to say that, is that enough is enough. We do have to have investment. It does take political leadership. It's not easy. We need to be able to, reallocate dollars as well as allocate new dollars. It's both of those, and and that takes real leadership at the top, and to be able to do that, and that's what we need in Oklahoma.
But let's talk specifics. How much are we talking here? It's easy to say that we need more funding because every facet of life here in Oklahoma needs more funding: education, health services, veterans care. How much money does mental health service need in order to really provide care?
Well, first of all, let's restore that the 23% cuts that you cited earlier. Let's restore that. Let's put that back up. Let's reallocate dollars, say, that are going to the Department of Corrections, downstream funding. Let's move them upstream toward prevention, being able to people to access care, and that's what we're talking about. Let's restore that 23% cuts that the Department of Mental Health, Substance Abuse Services had to make.